Everyone, this is Jerry Inspired. Very special guest. He's a hand specialist, orthopedic surgeon. This is Dr. Lucius Pomerantz. Welcome.
Hey, thanks for having me back, Jerry. It's awesome to see you again.
Definitely. And for those of you who haven't seen the first interview on my other channel, make sure to check it out. I will post a card. But Dr. Pomerantz, it's been a few years since we talked. What are you thinking about now in your specialty, in your kind of medical practice?
It's interesting. I'm 10 plus years into my career, and like any pursuit, you're never done getting better. But at the same time, I've gotten to a place now where there's not a lot that gets me anxious. I can probably handle just about anything that's going to come my direction. At least I know where to look or who to ask if I've got questions, so the anxiety level of performance in my field is reduced, which is great. It's good. But the pursuit of better is always happening. But it's a good place in my career. I'm still excited to do it. I'm still excited about trying to be better. And at least I don't have this lingering anxiety about performance that made up the early part of my career.
That is such a fascinating revelation for most of us, because a lot of times we think the doctors, the nurses, et cetera, they go through so many years of school, they work so hard, but we forget that they're human. Just like with any other type of job, there's going to be other emotions attached to it. So thank you for, being vulnerable.
Sure. Oh yeah. It's interesting. And the analogy, and I may have used this at some point with you, but getting our medical degree is like getting a black belt in a martial art. You've done a lot. You've certainly done more than many people to get to that certain point, and you've earned something special, but the learning has really just begun, and you're far from a master. You've just kind of gotten the baseline knowledge to then launch into the bigger thing. And it's impossible to be 100% prepared for everything that comes your way. And so a lot of the medical education is just understanding where to go and what to do when you're encountered with these situations.
Yeah, that makes so much sense.
Yeah. And so, and then, yeah, along with, us being human and having emotions and that kind of stuff, there seems to be a trend somewhere online and within the world of social media where surgeons are embracing that they have a pathology. There's a sociopathy or psychopathological issue. And I think there was some study showing that for psychopathic traits, certain surgeons do test higher. But it's mainly, I think, being able to compartmentalize and separate what may be going on in our personal lives. And there's always stuff going on in our personal lives with the job in front of us, doing our jobs, and which is usually helping the person in front of us. So, and we get better at doing those things too. So when you have less anxiety about performance, you can usually do your job better. So yeah, it's an exciting time in my life to be a better surgeon.
Yeah. One thing I will say is the sort of the dark tetrad or the dark triad that some people associate with surgeons, I think is slightly mislabeled. And I'm going to slightly place blame, not too much on Jordan Peterson for like getting that into the public consciousness. My hypothesis, again, everyone take this with a grain of salt, is that the nature of these high stress work, like Lucius says, it makes you have to systematize, have to silo, have to be like, okay, this is my private life, this is my personal life. I have to get into a certain mode. Sometimes surgeries can last 24 hours. So it attracts people that are potentially a little neurodivergent, and potentially, even if you're neural normative, whatever the heck that means, you might have to turn your brain a little neurodivergent. Again, I'm being careful with my words because I am actually diagnosed as autistic. So I don't consider being neurodivergent a weakness at all. In fact, I think it comes with way more strengths than weaknesses. But that's why it's like, I think we need to reframe some of this. And I think Lucius is kind of thinking about some of this stuff too.
Oh yeah, no, I've definitely put a lot of thought into it, and what is normal? That it's something we should all ask, and clearly people's brains work differently even when they're normal, and some people are going to be better at certain tasks than others. I think a lot of people can train themselves up to be better, but certainly other people, just the way their minds work and the way they prefer to do things, they have a natural advantage. But yeah, it's something to think about. Everyone comes at things with different viewpoints. Within the world of medicine, I quickly realized the eyeball, messing with people's eyes, was not going to be for me. I just watching someone put in contacts is just like, whoa, like no, blood, guts, bones sticking out of the skin, that kind of stuff. Yeah, it doesn't faze me too much. But the eyeball is like, nope. The window to the soul. I want nothing to do with it.
Did you grow up knowing you'd be a surgeon, you'd be a doctor even? Tell us more about that.
No, absolutely not. The decision process to go into medicine, just medicine, I didn't make until I was into college. And I guess I had left the options open. I was doing some of the pre-med courses and getting good grades, of course, just to have my options open. But it was, I guess, thinking of it as an option and seeing that I could do well in school, in college, on the courses that usually weeded people out, the organic chemistry. And I'm like, okay, I did it. I could do it. Medicine is an option. And I guess medicine as an option was there because I like the idea of helping people. Who doesn't? It's a job with a certain standing in society, which is appealing. And I guess you hear like, oh, hey, they make some good money. And hey, there's some of these TV shows that people make, and it seems really exciting and cool. And, you quickly realize that none of the stuff you see on TV is actually how medicine really works. But in the end, helping people was something that appealed to me. I was always fairly academically inclined. I liked the pursuit of knowledge. And I guess as I've gotten later in life and be able to put words to it a little bit better, not only is it the pursuit of knowledge, but it's using that knowledge to then help people. And that's what medicine affords me. And at first it was going to be emergency medicine. I probably because of the influence of the TV shows at the time, George Clooney, ER, like, hey, that looks awesome. When I got into medical school and I started going out of my way to round in emergency medicine, I realized it was not for me. The way our healthcare system set up, being primary care for people who are uninsured, poorly insured, or just didn't take the time to have access to their primary care doctors, like that. I'm not cracking chests or, massaging hearts or, this is just kids with the flu, and then you don't really get a connection with your patients. You're there for a shift. They're in and out. You're really hoping that people don't come back through, really. So I was realizing emergency medicine wasn't for me. And then I started getting my hands on things and being able to do stuff. And it's like, oh, procedures. I like doing procedures. And then, of course, that naturally led into surgery. And orthopedic surgery. Being a carpenter, in the end, is what really caught my attention, and that was a decision I made pretty late in medical school. Mm-hmm. So none of this was like a plan. It was just kind of throwing myself at anything and everything, seeing what I like, see what stuck, and going from there.
I think the journey you went on in your medical career is a lot like the journey I'm finally going on, which is I sort of narrowed a little bit in a direction. And even within the direction, I have some leanings, but I'm perfectly willing these next 2 years in my master's to be like, okay, maybe I want to pivot within this bound, right? So I think learning from you, I'm finally reaching that point. It took me a few more years, but hey, we all go through that journey.
Yes, we do. And it's always a journey, I haven't asked, what are you studying?
So I'm gonna be at Hopkins SICE, and I'm gonna get my master's in international relations.
Okay.
So, and I think when we first met, I was, working as a product manager on the side in addition to being a YouTuber. And before that, I was at ByteDance. So my focus is very likely going to be on tech policy. So something related to tech or AI and policy. I think we met during the time when everything was locked down. And I think all these years I realized that yes, you can like do your dream, do your own thing, but if you're not around the policy world, first of all, you can't understand where things are going, but second of all, you can't make as much influence as you want if you feel inclined to go in that direction, right? It's like imagine if
Yeah.
I were near to the policy world, maybe I could have like helped them make better policy during that time. Let's just be honest.
Yeah. 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 Yes. Actionable knowledge is what you're pursuing in a way, and I love it. But it's always a journey, and I think certainly I will say fortunate to kind of have this track that there's the next rung in front of me. There was the next thing that I could see, and all right, I'm studying for the MCAT now, and all right, do okay on the MCAT. Now I apply for medical school. Okay, get into medical school, and then all right, finish medical school, and then residency. There's this set thing that I could do, a path in front of me that wasn't hard to see. It was a hard road to travel, certainly at times, but the path was set out in front of me. But you quickly realize, especially now out in the real world, 10 years as a surgeon, there's other things that interest me. There's other things that I might want to do. There's other things that within the world of surgery I might want to pursue a little bit more. And it's always a journey. And sure, you may be jealous of that person who knew from the beginning exactly their passion in life, what they were going to pursue for the entirety of their entire lives. I don't know how they do it. It's probably I would like to think it's probably being a little dishonest, or maybe they're not living truly their passion, because I don't know how you can know early on or stay with the same thing. I think what we do and what we're learning when we're 20 is maybe a launching point to what we're going to do with our 30s, and then that's a launching point to our 40s, and on and on and on until we're done. But it never stops. It's always a journey. It's always a path. And I think it's great that who cares if you're older and, it wasn't a clean path. It never is.
I've been very, very thankful of all the support I've been getting. Like, there's so much rhetoric in the public geist about, oh my God, schooling's useless. Don't go to school. But like the true people who really see the value in it, they've been encouraging me. They're like, Jerry, you're doing the right thing. And I'm really happy. Thank you, Lucius, to encourage me too.
Yeah. And you bring up an interesting thing of kind of this populist lashback against the elitist, which hence is, gone through a lot of schooling type of thing. And at one point, I do understand that you don't need to do a lot of school to live a successful, lucrative, productive life. There's a lot of vocations where college is not going to serve you. I think the most valuable thing about academics is learning how to learn. And sometimes some fields, medicine, public policy, there's a lot of learning that needs to be given to you in a certain way that takes you to where you need to be faster and more efficiently. And certainly that may come with some biases within the system. Everything has biases. People who learn from the internet, man, talk about just inundated with biases. But knowing how to learn, and that doesn't necessarily require formal school, but this lashing against school and learning is not, I think, the right motive. I think pushing against maybe what is expected or the standards, that's fine to question those. I would want people to question the expectations of society, but the expecting, or the I guess the idea that doctors are somehow in the pocket of people because they're part of the system. It couldn't be further from the truth for the vast majority of the time. And I guess I'll just say it is frustrating. And then people are now not going to learn or learn how to learn. And it's a step back. So take that for what you will.
Yeah.
But learning is a good thing.
A perfect example to support Lucius's point. First of all, I love your first name, Lucius. That's such a cool first name. But I knew a person in LA who I had to cut loose for my life, but he was one of these people, always believed in that spiel of, the establishment is bad. Oh, education's useless. But he would then turn around and read books by very unqualified authors about money, and it was all bad advice. In fact, one book he read was a guy who got arrested for tax fraud, giving you money advice. And I'm like, wait a minute. Why don't you want to go get a degree if you're trying to learn anyways, but learning badly? It goes exactly back to Lucius' point about learning to learn, right? That's so important. And theoretically, that's something you should get better at as you get more educated.
Yeah. I mean, the process of learning how to learn is questioning the expectation. I mean, the best way to win a Nobel Prize is to create an upheaval or go against dogma. It may be hard, it may take courage, it may get a lot of pushback from the establishment. But when you win the biggest prize in science, it's because you've probably completely changed the way people think about things. And so the learning how to learn is questioning things, trying to gather knowledge from multiple sources, questioning those sources, trying to find, test, hypothesize, question your null hypothesis, experiment, see the results, come back to it. That's all this process of science and learning how to learn, not just, oh, this guy's saying he's different, and so I'm just going to read that and believe him. That's not learning how to learn. So yeah, it's interesting time because knowledge is so easy to come by. The barriers to gaining knowledge is so much easier than it has been in the past. People can access any surgical textbook. Doesn't make you a surgeon. So it's just an interesting time of parsing through knowledge and what wisdom might be and the application of that knowledge.
Yeah. And I think to build on this point and tie it back to medicine, what was the time in your medical career, whether in med school, whether in your specialist training, where you were like, wow, either you questioned something and you were right, or you were stuck and then you had a breakthrough? Do you have any examples of that?
Whether it's surgical training or even in martial arts, you probably think back 10 years ago, 15 years ago, a mentor of one sort says something and you're like, yeah, I got it, totally understand. And then it's years later, a decade later, where you're doing that thing and then all of a sudden something clicks and you're like, oh, that's why they said that. So you just get this extra level of understanding by trying and failing and experimenting, and then you have this deeper level of understanding, and that comes up all the time. Whether it's there's this certain type of dislocation of a pediatric elbow, a fracture of a pediatric elbow, and we had this policy at the Children's Hospital to always do surgery on it. And you read some of the older literature and you're kind of like, man, that seems kind of aggressive doing this surgery every time. But then you realize the experience of my mentors were that, yeah, you probably can get a closed reduction and hold it in a cast, but sometimes you have to really hold their arm in an awkward position. And that might cut off the circulation to their arm. And if the nurses aren't careful and they're just pumping this kid with medications, you cause this situation where it's called compartment syndrome. And the muscles die, and then they get this Volkmann's contracture. And so you're like, oh, to avoid all these complications and these other issues, surgery, which sounds aggressive, is actually the safer option, big picture, for the bigger system. And you're like, okay. But it took time and experience to understand at a deeper level.
because everything's so crazy right now, you've been noticing people who are into history have been looking back at the Middle Ages or even looking at ancient China to find wisdom, right? And sometimes people will be like, why? But Lucius' story is perfect to encapsulate that. The wisdom of people who've come before you, don't dismiss it automatically just because we got the new paradigms. Oh, we got tech, sometimes from years of experience, their stuff is good. And it takes younger people just like experience be like, oh yeah, there's a reason they advocate for all that stuff.
Yes, I think it is natural, especially when you're younger, to push back against the old person or dumb boomers, da, da, da. But there is a wisdom, and there probably are some universal truths that people who have learned perhaps the hard way can teach us. But sometimes to understand it, you have to make some mistakes again to get it. But I guess part of my understanding of the world of the past 10 years has expanded because whether it's kind of a rudimentary looking into and reading about philosophy or history, I find myself watching some YouTube videos about ancient Chinese history, and has nothing to do with my growing up in coastal California or current politics necessarily of the United States, but there's always lessons to be learned. And you realize, well, history doesn't necessarily repeat itself. It certainly rhymes, and there's always things you can get from it. But you really have to understand the context in which history was happening. And in the end, there are some universal truths that can come from it. And you're like, oh, okay, all right. Being kind is a good way of living life. It's always going to take hard work to be better. It never stops. These are some of the kind of the universal truths that I've come to, but it's by looking at what people learned 2,000 years ago and wrote about. And we're fortunate enough to, if we go back and look at it, like, oh, there you go. It's there.
What was med school like for you? Was it like a smaller med school, smaller class? Was it a bigger med school? Tell me about that journey.
Yeah. So I was in Albany, New York, Albany Medical College, which in itself was a big change from coastal California. It was, I guess, probably a small, medium-sized class. I think there might have been 140 of us per class. The biggest transition, the bigger transitions. One, I actually had to learn how to study. I thought I knew how to study going through college, and like, oh yeah, I stayed up all night. I did an all-nighter, and I did good on the test. But you realize, oh no, all of these kids that you're now with in school are smart, and some are way smarter than me. And it's going to take learning what's going to work to achieve and be better, especially if I have aspirations to get into a competitive residency and get back to coastal California and all that kind of stuff. And so, one, accepting that I wasn't the smartest. Two, humility was going to push me to be better. And I had to figure out, oh, okay, like I have to see things 3 times for it to really kind of sink in. And making mistakes does accelerate the process of learning. And so flashcards and getting it wrong and coming back to it and like, okay, now the answer's there. And this analogy of medical school being you're drinking from a fire hose, it is. You're getting so much information, all of medical knowledge up to that point condensed to 4 years, and it's just being thrown at you. And so accepting that you're not going to know it all. It's impossible to know it all. But if you can understand some fundamental concepts and how to find the right answer, you're going to do all right. And it took some time, but I did. I got it to a good enough place in medical school where I did fine. And the bad weather of upstate New York helped me stay in the library and study that much harder. It's like, I don't want to be outside. I'm just going to study, get back to San Diego.
Yeah, that's quite the motivator.
Yeah. And then, I think something else that was new to me was a competitiveness. I had never brought competitiveness to academics. I'd wrestled, I'd been in martial arts, I'd done Brazilian Jiu Jitsu, and I knew what it was like to compete and what it took to excel in those things. I was going to hit the pavement, do the extra miles. I was going to go to the weight room. I was going to drill the technique that much harder. Same thing in academics. I'm going to stay here until the library closes, and I'm going to get through this chapter, and I'm going to understand it that much better. And I know my classmates aren't doing it right now, and I'm going to beat them. I'm going to score higher than them on the next test. And maybe it's not the loftiest of goals, but it was motivating, and it got me to my higher goals. So, and because I put the work in as a martial artist of drilling and putting those reps in, I was probably a little mentally stronger and knew what it took compared to some of my classmates. That was my advantage, because I certainly wasn't smarter than a lot of them.
I will back you up on both points you made. One, which is that I noticed that shift in me too. Obviously, I went to a very good undergrad institution, but I didn't have that, well, let me just do 5% more than you guys. But I have that now. Like during my summer classes, even if I don't necessarily need to go to office hours, I'm going to office hours. Even though the professor said you don't necessarily need to read the textbook, I'm reading the textbook. So I'm just being like, I have a little bit of extra hard work and motivation that I know some of you aren't going to do. I assume some of them aren't, but I'm like, some of you aren't doing that. So already that, I have an advantage. And the second thing also is, like how you were bringing a lot of the transferable skills from martial arts. For me, since last time we talked, I put martial arts a little bit on the back burner to play a lot of chess. And so a lot of the skills I learned in chess have actually helped me. I'm taking an econ class right now, and I'm about to take a stat class. We'll see if it helps in stat, but it's helped me in econ so much, because chess is all about being able to think in different directions, and especially intro to econ, which the course I'm taking is technically not an intro to econ, but Hopkins calls it intro to econ because Hopkins has really high bar when it comes to STEM stuff. So
Sure.
like, any other school be like intermediate econ, but Hopkins, it's like intro to econ. And like, I'm like, wow, I suddenly can understand it, because sometimes you need to look this way or this way, or instead of just always looking this way, which was one of my issues when I was taking econ undergrad. So long story short, I agree with both of you. Even my parents, they've been noticing, like, Jay, why do you like get so stressed out? I'm like, it's not that I get so stressed out. I'm just more motivated now. There's a difference. Yes, it comes with stress, but it's also like, I want to achieve more than my classmates.
Yeah, it's great. And learning how to learn, and the pursuit of mastery in one thing, whether it's martial arts or now chess, which is awesome. I'm horrible at chess, but at the same time, I've never really committed effort to getting good at it. But the skills of whether it's learning in multiple directions, or luring people into traps, or working just that much harder, whatever it might be, it carries over into the other things. And so, I did a mixed martial arts fight in medical school, fought in a cage and trained hard to get there. And then after doing that fight, it did go well for me. But after that, the rest of medical school was easy. It's like, man, I'm not having to get my ass kicked right now. I'm not being punched in the face. I'm not being choked. Like, all right, I'm tired, whatever. Like, I'm good. So yes, transferable skills and the pursuit of mastery in anything carries over to the next thing that you're going to do in life. It all builds on itself. And so, yes. And along the lines of chess, I was recently at the Association of Ringside Physicians annual meeting. And it's a really cool, eclectic meeting. People of all kinds of backgrounds, doctors like me who are into martial arts, who do some ringside stuff. And then there's fighters, and then there's referees and all these other people who are involved in the sport. But there's a representative there who's big in and pushing the chess boxing, which is, they go at it with boxing, they go at it with chess, and it's interesting, cool sport that I'm just like, that's really awesome.
First of all, shout out my fellow library patron, Chad, because he also is a ringside physician. So it's cool, Lucius, that you're a ringside physician too. But yeah, just what I think the martial arts community, and especially people into combat sports, have realized the past 10 years, especially, is that the best fighters tend to be very smart, right? It's
Oh
not a
yeah.
brawler sport. It can be, but if you want to get to the highest level, you got to be smart about it. And so, even the most raw thing, whether combat sports or combat in general, like bang bang shooting, requires a lot of brain power. It's not just like, oh, I've got to be strong. I don't got to be brave. That'll just get you knocked out.
Right. I mean, when you get to a certain level, and being at the elite sports level, that I am certainly not athletically at that level, but I've been around it and I've seen it. All of these guys are in the 99th percentile of speed and quickness and strength. It's the guys who can learn, stay humble, change their approach, give the other guy more things to think about. Those are the guys who can be cerebral, that end up excelling. And so certainly attributes like strength and speed and all that kind of stuff can take you far. But if you don't learn how to work and use it, you're not going to be the best.
Yeah, exactly. So you're orthopedic surgeon, you're a hand specialist, you're a doctor. Does that mean you had to take 3 boards?
Yeah. So
What?
the hoops you jump through. So college, you take the MCAT, which is this standardized test, and it has since evolved since when I took it, but important standardized test that gives you a score. And the med schools, along with other things, look at that score and decide whether they're going to interview you or not. Then you get into medical school, and there's a series of boards, United States Medical Licensing Exam. And to be able to practice medicine, there's step 1, there's step 2, there's actually a step 2 clinical skills portion. And then, which most people take in their first year out of medical school, there's step 3. And all of these you got to take to and pass to have your medical license and practice medicine in the United States. Then in residency, whether you're going to go into emergency medicine or orthopedic surgery, there's a board examination for that usually take at the end of your residency, and you have to pass that to then be a member of your board, whatever that may be. And sometimes it's more than just a written test. In orthopedic surgery, there's actually where we have to fly, and well, actually now it might be telemedicine or by screens, but you have to do oral boards where you have cases that you've done while being in practice at the early part of your career and defend your decisions, prove you're not a cowboy and that you're doing things right, and be able to justify your decisions. And so that's orthopedic surgery. Not everyone has the oral boards. And to become a hand surgeon, there's a separate written exam based on also having a certain amount of cases that you're doing in hand surgery to then qualify for the extra certificate of added qualification in hand surgery. So a lot of hoops to jump through, because I don't know, maybe I'm a goofball. I guess it was about 1.5 years ago, I decided to get another board certification in something completely different, lifestyle medicine.
Oh.
And lifestyle medicine, it has an American board of lifestyle medicine. There's a college of lifestyle medicine. There are some residencies popping up of lifestyle medicine, and but it's all relatively new. And they have a cool system where if you're already board certified in something else, they can kind of expedite your path into it. And so I had to do some extra learning, some extra online courses, extra going to a meeting, and then taking another standardized test to get this board certification. So it's all part of the process, but there you go.
Wow. I think what I learned from you is that even the standard quote unquote board that like every doctor has to take, I didn't know it was split up into different parts. So that in itself, like I really feel for the doctors. Like, I got a friend who I don't think I ever introduced you, but he's in LA right now. I'll definitely connect you guys. He's an oncologist. So like he's about to take his board for his oncology, but before then, literally he was always studying. And I was wondering, are you just like a guy who loves to study? But now I know it's like probably part of it was just to get the boys for being a medical professional. You had like 3 little phases. I didn't even realize that. So you taught me something about the testing process.
Yeah. And I mean, oncology, man, more power to him. A really important job. But that was another one of those fields that would have been hard on me. Yeah, dealing with cancer and that kind of stuff is not for everyone. And so the people who go into it, man, more power to you. And as you can see, there's tons of hoops that doctors have to jump through, certain standards that you have to meet to be what you are. And so those out there who are interacting with physicians, hopefully in good ways, know that we did a ton of work to get where we are. But also, the work does not end. I'm often still reading journal articles, and what's also great is there's online videos. You know, a really experienced surgeon puts up a cool little YouTube video, and you're like, oh, okay, I liked how he did that little thing. So the learning never ends, but going through all the hoops we go through, you learn how to learn. And sure, some of the stuff you learn when I was in medical school, 2004 to 2008, that is for sure outdated now. Some of it is not stuff you can use. And if you're still doing it these days, you're probably not practicing good medicine. And that's why it's impossible to become a specialist in everything, because everything continues to evolve. People question the dogmas that are out there, invent something new through experimentation, develop a new technique, new medications are created. And if you're not staying on the cutting edge, you fall behind, and you're not then doing your best as a physician and helping the people the best you can.
Yeah. One perfect example of this is for my OT for my hand, I actually went back to the place that I did PT for my glutes back when I was in high school, just because it's in the area again. And I told them honestly, I'm like, dude, the PT paradigm back in like 2004 was very different. Like back then, again, first of all, the PT wasn't really able to identify which muscle to strengthen to prevent my glutes from always feeling pain when I was doing kicks and stuff. But on top of that, she also said, well, if this sport's always causing you pain and it's causing your body to do certain things, maybe don't do it anymore. Basically, after she said that, I stopped doing martial arts. It wasn't completely her. I take personal responsibility because I'm like, I need to focus on school. But I'm sure her advice didn't help, right? So like that paradigm has changed even from a PT angle. Now it's like, how do we strengthen the right muscles? If you want to keep doing it, as long as it's not like permanently damaging you, temporary pain's okay. Just like, how do you get past it? How do you strengthen your body, right? So even that in itself, just going back to the same location has like seen the paradigm change with different generations.
Oh yeah, it continues to change. And, some of it's based on, a new understanding of how muscle lengthening works neurologically, as opposed to just the function of the muscle fibers. Or it could be a better understanding of the sport itself. Certainly we have gotten better at treating sport-specific injuries. And I think society has also changed in the expectations. 40 used to be over the hill. I still have ambitions to train hard in jiu-jitsu. And frankly, if someone tells me stop doing it, I'm probably not going to listen. So along with societal changes, knowledge about how the body works, and advancing our techniques, of course, things are going to change. What's really interesting is then you go back and look at a very old German text from 1925, and they're talking about their findings. And you're like, that's exactly what we're seeing now. So this iterative steps, going back and circling around and rediscovering and always trying to get better. There's certainly foundations based on what was known, and you launch from there.
Yeah, exactly. And again, that's a great callback to what we talked about at the beginning about don't always dismiss stuff from the past, right? And even in martial arts, like people are like, "Oh, I invented this new guard, this new submission in jiu-jitsu." It's like, well, look at old judo texts; it's all in there.
Right.
Very
Yeah.
similar example.
Oh, totally. Yeah. I mean, no one, no one is inventing things with the human body. Humans have been fighting each other and wrestling each other for as long as we've existed. We've only been writing about it in the past couple centuries. We've only been doing YouTube videos about it much more recently. And so someone may have rediscovered something really cool or a new application of something, but to have the hubris of thinking that you have invented something, either you are exceptional or you've done something cool and rediscovered something that people have known about, and maybe you can apply it in a different way.
Yeah, exactly. A question about surgeon training slash hand specialist training. Did you guys have to use like sort of these like almost looking like human type like robots to do some of the training?
Robotic surgery has not made its way into applications with hand surgery. There are robots that assist surgeries. There's no pure AI doing a surgery. That doesn't exist. But there are robotic surgeries, certainly within the world of urology and obstetrics, gynecology, where outcomes are improved by using these robots that cost $1 million. But by reducing tremor, improving visualization, things like that, you can do the surgery a little bit better. But it still takes a surgeon moving the robot, who they also received a lot of extra training to use the robot. And then there are some things working their way into orthopedic surgery, joint replacement surgery. There's growing evidence that robot assisted helping you guide where you're going to cut the bone does overall improve outcomes. And it's this battle, the old people, I've done this surgery thousands of times. I don't need some robot to tell me where to make the cut, versus raising the whole standard of care by trainees who, hey, yeah, if a robot can help them make a little bit better of a cut that improves their outcomes, awesome. And there'll probably be more developments as we get better. I don't see AI replacing me as a hand surgeon anytime soon. But maybe robots can help me do my job better.
Another reason I asked this question, so my dad didn't end up going into like being a doctor in America, but he was trained as a surgeon in China too. And China in the 80s was very different than it is now, and of course it's very different than America. And what he told me was that to practice surgery in China back in the day, you would do a lot of surgery on animals first to prepare. So he did a lot of surgery on cats and stuff like that, which, now with how we understand animals and stuff, especially in the Western world, that's going to be like, ugh, right? But that's why he said part of the reason why surgeons are so good, especially the ones that got trained in China and came to America, was because a lot of them from that generation had the training of, oh, let me first start doing surgery on dogs or cats and stuff like that. So that's another reason I asked about training methods, because obviously we're not going to do surgery on cats and stuff in America. But let's say you're someone who gets started with surgery. How do you kind of build up to, okay, I'm going to do my first surgery on a human? What is the process for a lot of people who might be interested in that?
Yeah. So these systems that we've touched on, they are built to get people to a certain standard. And we'll go through the process. Just before I forget, talking about working on animals. It still exists, even in Western society, not necessarily with dogs or cats, because of societal things around those wonderful animals that are our friends and companions. But certainly some research, even a few decades ago, were using dog Achilles tendons to study how tendons heal after surgery or after injury. As recently as that was 2015, 16, 15, I was practicing microsurgery on rats Just so happens that their femoral artery is very similar to the digital artery of a finger. And so you learn how to work on a microscope and restore perfusion on a rat leg that will hopefully help you be better at a human finger. So there still is that as part of the training and gaining knowledge. Now we are getting better at simulating certain things, whether it's computer and virtual reality, or in orthopedic surgery, we have simple sawbones where it simulates a fracture and you practice doing it. So there's lots of different ways. And there's a few ways you have to come at it. One, because some of us aren't born to be surgeons, I'd say the vast majority of us aren't. The cutting open of a human is pretty weird and scary, and it should be. And so in medical school, in that first class on anatomy, you start dissecting a cadaver. They're not alive. They haven't been for some time, but you start learning how the human body looks by cutting it open, moving things around. And at first, most people are pretty squeamish. By the end of the year, people are eating in the anatomy lab, don't realize that they smell like formaldehyde, and you get desensitized to the whole process. And you work through it, and then, maybe you put stitches in someone in a very closed off way. Surgeries, we're not working on the whole human. We're just working on a little body part that's draped out. We're operating on the elbow, not necessarily the human being. So it helps you compartmentalize a little bit. And you start as a student, maybe closing the skin, doing a very simple thing that, yes, you can mess up, but you're not going to cause catastrophic harm necessarily. And as you get better with your hands, you get better with your knowledge of anatomy, you get better with understanding what you're trying to do with the surgery, you get to do more and more. As a resident, you get to make the incision, which, all right, cutting open the skin isn't necessarily the most important part of the case when you're trying to fix a fracture, but it sets up everything. If your approach to the anatomy is wrong, starting at the skin, it makes everything way harder. And so maybe the attending surgeon doesn't let you make the cut until they check where the incision is going to be made. And then they watch you make that incision through the skin. And if it looks good with the skin, all right, you can go through the fascia now. Oh, I don't like that. They're going to bump you out of the way and take over the case. And so then you go, all right, well, I got this far in the case. I've got to read more. I got to learn more. I got to know what the next step is. And by the time you finish the surgical residency, which is usually 5 years after medical school, you've gotten to a certain standard where you can do certainly the basic parts of that field, whether it's fixing a fracture or replacing a joint, and you go from there. But it's a slow iterative process, and there are standards and there are mentors who, it is great that some of these wonderful, excellent surgeons have committed their part of their lives to making the next generation of surgeons better. It certainly makes their job harder. But it is a stepwise fashion in doing anything and everything.
And I didn't realize that surgery residency is 5 years. Wow, you guys really put the time into it.
Yeah. And that's most surgical residencies. There's some that are longer. Neurosurgery, I think, is at least 6 years.
Wow.
And then if you're going to specialize, like I did in hand surgery, that's usually an extra year on top of things. So yeah, the process goes a long time, as it should. I know if anyone's going to operate on me or a family member, I want to know that they have put in their work and have gotten past very difficult things to get to that point.
Yeah. Wow.
And I guess another thing that I do want to point out about training is surgeons, yes, we are in a way technicians. I kind of half joked earlier about us being carpenters, us orthopedic surgeons. We're dealing with hammers and drills and saws. But a big part of our surgical training is also decision making. You see the broken bone and like, I can fix that. But you also have to realize that this patient who may not survive the surgery because of other medical issues, or may not be compliant with post-operative restrictions, or you're not going to have good follow-up on, it might be best not to fix the broken bone, because you might subject them to worse complications. And so a lot of it is making the right decision along the way. And that comes with experience and wisdom and a lot of reps.
And I will add to that, this is more reason people to listen to your doctor, right? So
Yeah,
they can give you the best treatment knowing you're going to listen to them.
I hope. And I will say there are some doctors out there who do not have good bedside manner and aren't good communicators. Along with, we talked about neurodivergency and just neuro differences. The people who can go through these 20 years of schooling aren't necessarily the most sociable and charismatic and fun people to be around. And I will admit, sometimes when I'm tired, or I am dealing with a language barrier, or whatever the reasons may be, there are certainly ways I can communicate better, and I don't. And it's something that I'm trying to work on. It's something I can be better at. And so I'm trying, but I'm still not perfect. But if someone's out there and they have a bad interaction with their doctor, it happens. We're human beings. I can assure you they are trying to do what's best for you. But you can always get a second opinion. You can always do your own reading, come back to them with a different understanding. And writing that Yelp review online is not necessarily going to change anything or anybody's mind about anything. So if anything, medicine's changed in the past few decades to being a cooperative process. Way back in the day, as a surgeon, I could just go, "Hey, we're doing this," and the patient be like, "Okay, I guess that's what we're doing." Now I expect my patients to expect me to explain why I'm doing what I'm doing and the ramifications of what I'm doing or not doing, the risks, and encouraging them to seek out other opinions if there's time. There's some emergencies where you don't have that, but yeah, it's how we evolve and deal with the society that has all the information available to it. I just have learned how to make decisions and have a certain wisdom about the way I make them through my training.
Yeah. I think that's such a great thing to remember. It's like there's the skill, but skill also in decision making, right? And that's something you get trained, and as you just get more experience, you get better at.
Yeah. I mean, there's countless times you talked about, learning earlier and kind of things that you do differently, but you can learn, you read about a surgery in a textbook, you then assist that surgery as a resident, and then you start doing that surgery in the real world and realize there are so many other things going on that make the surgery successful, from the preoperative workup to the actual techniques in the operating room to the postoperative rehabilitation and getting therapy involved and how long you immobilize them and setting expectations on when the patient can return to the things they want to do. All of these things go into our outcomes as a surgeon, and it's an art.
A point you made earlier actually brings up something really cool, and it's a question for you. I actually had neighbors in Santa Monica back in the day. Shout out Kyle and oh, they're gonna kill me. I forgot.
I'm bad with names, so.
But they had two dogs, and the dogs actually did either an ACL surgery or a Achilles surgery. I forgot which one. Do you ever do that for or so that would be veterinary medicine? That would be something.
Yeah.
Yeah. Okay.
Yeah. Within veterinary medicine, there are specialists. There are veterinary radiologists. There are veterinary orthopedics. There are specializations within veterinary medicine. There are stories certainly of a long time ago. An orthopedic surgeon's dog breaks their leg and they find an anesthesia resident after hours and they take care of the dog. These days, with hospital policies and utilization of resources and things like that, it would probably get you in a lot of trouble if you try to do something like that. But there's also stories of at a zoo, the gorilla breaks a bone and maybe there's no veterinary specialist in the area who knows how to deal with a big bone like that, but there are orthopedic surgeons who deal with humanoid large bones and can figure it out. So yeah, it's an interesting thing. And in the end, a broken bone is a broken bone, but sometimes they come in different sizes.
That's super interesting. See, like, this is why I love these conversations, because I didn't even know that within veterinary medicine, which is, of course, separate from like doing human medicine, there's specialties within. Wow, the world is so vast, man.
Oh, there are so many layers to it all. Specialists on specialization, and it's good. I again, if I am going to have a surgery on myself, I want to go to the person who's done it a bunch of times and has dealt with all possible iterations of it and potential complications of it and know exactly how they need to deal with it. At the same time, I think as we personally also, you get so hyper focused, you sometimes lose sight of some of the important things of why you got there or why you're doing what you're doing. And that was part of the reason why I went in. I got that extra training in lifestyle medicine is, yes, I love orthopedic surgery. I love being this carpenter. I love helping people restore their own function and get back to the things they love doing. But what is it big picture? Well, they're getting back to a lifestyle that they want to live. They want to do the hobbies they want to do. They want to be able to go jogging because it makes them feel good, which helps them sleep better at night, which encourages them to eat better, which then they can, cook better food for their families. There's, this huge bigger picture that we often forget about as we subspecialize and get deeper and deeper and deeper into the weeds. So taking a step back and seeing a big picture, learning from history, and delving into a little bit of philosophy is helpful too. You can kind of maintain purpose within your subspecialization.
And this is a question I would have never asked until now, when I found out that engineers have to take ethics courses. Do you, as medical professionals, have to take ethics courses?
Well, one, that's awesome. I love to hear that engineers learn ethics. Yes, there is ethics and professionalism within the world of medical training. Some schools will have dedicated courses to this. It is for sure part of what we learn. Hopefully, some of the training and the tests you do and the working with human beings filters out the people who do not have good ethics and morals. A big part of the oral boards that we take as orthopedic surgeons, and I mentioned being a cowboy, is they want to know, the board of orthopedic surgery wants to know that, are you ethical? Everyone has complications. Everyone. No one doesn't have a complication in there, especially in the early part of their career. Did you hide it? Did you just punt it off? Did you try to bury it? Or did you do what's right? Do your best for that patient, get them through it one way or another. The easiest way to fail the board of orthopedic surgery is if they find out you had a complication and try to hide it. So yes, ethics is a huge part of it, and part of the filtering process of being a good doctor. And in the end, that is a fundamental pillar to being a doctor. There are levels to being a surgeon. There are excellent surgeons where just whatever they touch turns to gold and it's perfect. And some, maybe they've just reached that standard of care. But if you don't have ethics and professionalism and a way of doing the right thing, whatever that may be, you're not going to be a good surgeon. So yes, that is a crucial part of everything.
And part of the reason I been thinking about this is there was a program I got into, which I didn't end up selecting, but it was a program on HCI, human computer interaction. And part of HCI is also looking at the ethics of where all this is going. And what I learned, even though I'm not doing that master's, I still want to think about this because obviously everyone is using, computers and smartphones, etc. But one of the things I learned is that a lot of what you think about in information sciences or computer science, app design, designing a website, those people usually don't take any ethics classes. So
Yeah.
then you wonder why certain apps are so hard to use, steal all our information. It's like, hey, maybe I can't say it's causational, but it might be correlated,
Right. It's an interesting thing, talking about the history of science and humans and philosophy and learning. It's a parable, Frankenstein's monster. The can you do it or should you do it? To what end are we getting by developing this technology? And yes, technological innovation is part of what humans do. We push boundaries and I hope the people who are doing it are asking, to what end? Is this to benefit society? Is this to make something we do as a society better? Or is it to make me money? Or is it to make our algorithmic overlords more powerful? I hope that people are at least stopping to ask, to what end are we doing this? And, AI, man, the potential to help humanity is tremendous, whether it's developing new drugs or looking at how proteins fold to identify new ways of attacking disease, or streamlining medical processes, or cutting out all the middlemen that we add to our bureaucracies within the medical world. There are potential benefits to AI, and I want to see it developed. But I also I hope that the people who are developing it are asking, to what end, and putting boundaries and guardrails. And I don't know computer science, how you install or try to instill ethics into an artificial intelligence. I'd like to think we can, I'd like to think that the vast majority of humanity has certain baseline universal truths and ethics to it. And if we're making this thing, we do that to what we're making, just like any surgeon should ask, to what end am I doing the right surgery for this right patient? Computer scientists and the entrepreneurs who are pushing these boundaries, I hope, are asking the same questions. Because if they're not, it could be terrifying.
And we've had such a great conversation, and I know you're a pretty busy person. So do we have time for one last question for you?
Let's do it.
Okay. This is a more technical question because I'm doing occupational therapy right now on my hand, and I don't know how to communicate this to my occupational therapist. So I was like, okay, you would be the person to ask. But what is this area called? This area, it's like, I guess I don't know if it's a tendon or a ligament here. What is that called?
So you're pointing at the area between the fourth and fifth metacarpals, which are kind of the long bones of the hand that are the platform from our wrist to our fingers. In between the metacarpals are several muscles, and those muscles have tendons. And those muscles' jobs are either to open the fingers up or to pinch them together. Chances are it's one of those things going on, assuming you're not pushing right on a metacarpal, which could have an injury in itself, the bone itself. But and then a little bit further down from there is the joint between the little wrist bones and the metacarpals, and so that sometimes is injured too. So I've seen your finger migrate a little bit, but the people who punch things certainly can strain the little tendons and muscles within their metacarpals, but they can also strain the joint between the metacarpals and the little wrist bones. Carpal metacarpal joint sprains, strains. So those are the things that I would be thinking about. based on our telemedicine visit here.
Makes sense. So, again, for everyone watching, this is not medical advice. This is just academic / intellectual. So,
Yes.
if I were to communicate with my OT, would she understand what I'm saying if I just sort of like tell her, oh, it's in between this area? She would kind of understand. I
Oh
wouldn't need to
yeah.
be like super specific.
No, occupational therapists, just like everything, are specialists in their world of therapy, and they know things I don't know for sure.
Mhm.
And that they are incredibly helpful when I'm trying to help my patients rehabilitate or prehab for a big surgery. Hand therapists are fundamental to it, and they know the anatomy. They have an understanding that I don't have because I don't have their background. They're viewing things in a different way. So certainly explaining kind of like how it hurts here with these activities after doing this, all of that gives them a framework to work within. They might be pushing on stuff to go, okay, it doesn't hurt here, but it does hurt here, or it hurts when you open your fingers or close your fingers. And that's all going to give them information to target. And also help you rehab. Yeah. So use your therapist. They're excellent.
Yeah. And I hope what I just demonstrated is don't be afraid to ask questions, right? There are no stupid questions, especially when it comes to your own body. Like, I was like, because like for me, I'm not asking it because I think it's a stupid question. I just didn't know where to start. It's like, how do you describe this? But basically, I realized like I was overcomplicating it. All I need to do was kind of like basically what I did here. I could have just like took a picture, sent to the OT. That's what like Lucius kind of gave me all this stuff about, oh, what's in here. That's all I need to. I was trying to be like, okay, how can I like technically explain to her? No, that's her job. I don't need to like be too technical.
Yeah. So some of it, one, vulnerability, willing to ask questions. No professional is going to be angry because you wanted to understand more. And then also just gaining knowledge for yourself will give you a concept to that then the professional can build on to help you get better. If you understand why they're having you do an exercise, that's going to help you do it so much better than if you're just going through the motions.
Shout out my OT. Her name's Kendall. And I was going to make this joke, but I was like, once I get to know her, I'll do it. But it's like, when you think Kendall, you think Kendall Jenner, right? But no, it's not Kendall Jenner. My OT's not Kendall Jenner. Man, her name's Kendall. Really funny. So I gave a lot of shout outs today. Let's see if Daniel has a question. Daniel's about to do like a PhD. Okay. Or sorry, an MD. So he doesn't have a question. But anyways, gave him the opportunity to ask a very specialistic question. But guys, this was Lucius Pomerantz. I think this was a great stopping point, a great interview. Every time I talk to you, I learn so much from you. And I think we will definitely bring you back. Maybe you'll be on a third channel of mine, but I think on this channel, I'd love to have you again.
Hey, it's an honor. It's a fun conversation. And I think for both of us, the learning will never end. We're always going to try to get better. So
definitely.
There you go.
Are you ever going to do like a science or medical meeting in the DC area at all? Do you ever have business trips like that?
There are definitely meetings I go to, whether they're in Washington, D.C. or not. It varies year to year. I hope to get out there. And if I do, I'll definitely let you know.
Yeah. And then we can do an in-person talk.
There you go.
Definitely. So, do you want me to link anything, like a website or anything?
Yeah. One of these days I'll actually launch my own website, but I've got a very small footprint in the world of YouTube. Cut to the Bone is my YouTube channel, and there's some information about hand surgery and martial arts and lifestyle medicine. Instagram, Dr. Lucius, or maybe now it's Dr. Lucius MD. I don't know. I changed it recently. Either way, you'll find it. And, there's stuff out there combining all these things, learning and getting better. And I'm pretty good with answering questions if people want to go through those venues and ask something. So
that's awesome. So guys, Dr. Lucius Pomerantz, he'll be back. And if you guys have any questions, leave them in the comment section here too. But I will also link the website and the Instagram.
Thanks for having me.
Absolutely. So guys, thank you so much. This was another great interview on Jerry Inspired.